Hey, spring training time in beautiful Surprise, Arizona, and the man who runs the show, Dayton Moore, general manager of these Kansas City Royals. And Dayton, I got to ask you about this training staff and this medical staff, how they keep these guys together, and this wonderful partnership that you have with the University of Kansas.
It's a great partnership, as you indicated. It's made us a lot better, I can tell you that. And Nick Kinney and Doc Key have a wonderful relationship, and we rely on the expertise of Doc Key and all the unbelievable medical folks at KU Med to keep us going.
I talked to a lot of the players, and they say in a lot of organizations, players are skeptical to go into the training room or talk to trainers or talk to the doctors, but that's not the case here. There's a wonderful relationship and a trust factor that's here.
Well, it starts when the players first join our organization out of the draft. Even when they come over from the Dominican Republic, I mean, we encourage our players to take part in a lot of preventative type medicine and being in the training room, communicating well with our trainers, and then obviously that carries over to the medical staff as well. And so we want a culture in that clubhouse, one that has very open and transparent communication, and that's how you keep your players on the field.
And so far, these guys say that they wouldn't want to be anywhere else. I mean, when you have that type of trust and that type of relationship and that type of bond with these guys, that's unimaginable.
It's important, and you know what, when everybody needs to keep their players on the field, and we're a small market. We don't make excuses for our market, but it's even more important for the Kansas City Royals to make sure that all of our top players are out there every single day, or as much as possible, so we can keep them going, because we're not going to have as much depth as maybe some of the other teams. And so the medical part of this is huge for us, and we're very proud of what Nick Kinney does, what Dr. Key does for us, and as I said, the entire group is special.
Now, you oversee this organization, but as a general manager, as a parent, we get an opportunity for some of these trainers and this medical staff to give the same type of treatment to everyday people at high schools, people in middle schools. How huge is that for the general public to have the same access to the same care that you provide here?
Well, there's no doubt, and it's important. And so the fact that the medical staff gets to work with the elite athletes, and so they can take everything that they've learned and then obviously apply it to the general population. And I think it gives you a lot of confidence. I know it would me personally.
Have you had an opportunity to go into Dr. Key and say, "Hey, Doc, I got some nagging, some aching here. What should I do?"
I try not to be high maintenance. That's for our players, but I know KU Med has been important for not only me personally, but our entire family. They've come alongside of us in some meaningful ways as a family on a personal level.
This team is working hard together to be in shape, to be healthy, and to get to another World Series run. The Kansas City Royals, University of Kansas Health Systems, a winning combination.